Hello, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH CORE. Welcome to our webinar on electronic healthcare attachments. Next slide. I would like to mention a few logistical items. A copy of the slides and the webinar recording will be emailed to you in the next day or so. Also, we will have time at the end of today's program to respond to your questions. I encourage you to submit your questions at any time during the webinar by typing them onto the questions panel on your dashboard. Next slide. We have a lot to cover during this call. We will start off with background on the topic, so we can then walk you through the work CAQH CORE has been doing on attachments, including talking about our attachments initiative and environmental scan. We'll then talk about next steps in our initiative and move on to our Q&A portion. Next slide. I would like to thank our guest speakers, in particular Mandy Moles from CareSource. Thank you for being here today. Next slide. So now we can get started. I'd like to introduce our first speaker, Mandy Moles, who's an e-business analyst at CareSource. Welcome, Mandy.
Thank you so much, Jessica. I appreciate it, and thank you for allowing me to speak today. We can go ahead and move to the next slide. So, as some of you have experienced, there are some foundational concerns with attachments. This slide speaks to the fact that attachments are very costly to conduct in the current environment. Many of them are not done electronically through EDI. Currently, CAQH CORE is working to promote adoption of electronic attachments through their phased approach. As you can see, there have been many phases of operating rules, 1 through 5, that CAQH CORE has addressed. The rules look at very specific components and challenges within the administration of healthcare, with topics ranging from eligibility all the way to prior authorization. Attachments are the next step in progress at tackling some of the most burdensome components of health administration. We can move to the next slide. And here you can see information related to the components of attachments and methods of exchange. The first is establishing a basis of how we categorize attachments. It's important to note we see attachments as relating to claims and reimbursement processes, prior authorization and value-based payment models, as well as being important to audits. Providers are required to pull specific patient information and supplemental data and provide that to a host of other entities in the spectrum of healthcare, including health plans, auditing organizations, and others within that cycle. The method of exchange for this supplemental documentation that providers, health plans, clearinghouses, and auditing plans use can vary. It can be manual, such as printing it out, popping it into an envelope, licking a stamp, and mailing it in, to fax machines, which are very popular, to partially electronically. CAQH CORE defines web portal interface as partially electronic. Web portal interfaces, which are becoming more common today, are web services where providers can log in and upload an attachment or part of a medical record or a form that has to be filled out and supplied to another entity, typically a health plan, and submit that partially electronically. It is considered partially electronic because components of the workflow still require manual intervention. There's still quite a bit of lag in the implementation of fully electronic, but there's been a lot of progress made in the industry. CORE is currently engaged in conversations to ensure workflow from the provider and health plan side can take advantage of completely electronic models, both with standards and operating rules and roles and responsibilities defined so that progress from a manual to electronic means of sharing additional data and information in the most streamlined way is possible. Moving to the next slide, we can see, excuse me, that through a variety of different models, CAQH CORE has been able to track the progress in the industry on how clinical documentation is being exchanged today versus where it can go tomorrow. There are specific benefits for the use of standards and electronic submission of the additional documentation or attachments. This includes a reduction in the number of health plan denials for additional documentation. Electronic attachments protect PHI as it is being transmitted from one entity to the other. In addition, they reduce very specific costs related to storage materials and scanner fax machines. Further, electronic attachments reduce the time it takes for payments to be made and timeframes for care to be delivered. There are savings for all stakeholders, so it's not just a win for providers or just a win for health plans. All stakeholders within the continuum that participate in the conduct of this transaction received benefits in a fully electronic EDI model. There are a range of current standards and emerging standards that exist for attachments today. Many of us are probably familiar with PDF and JPEG, as well as SOAP and HTTPS. But those are just a few of the many different standards for the type of data in which it can be encapsulated in and then shared through the internet. There are also a number of standards that have emerged over the last few years that are currently being used to conduct some of these transactions. Again, it's still a minority of the transactions, but X12, HL7, CDA, HL7 Fire, and Direct Connect are all new or newer models and modes of both encapsulating the data within a standard and then sharing that standard via different means of connectivity with your trading partners. Also, it is important to know that as value-based payment models continue to grow, these models have increased the data requirements that providers have to share with health plans and other organizations. As we look at modes for attachment standards, we need to ensure they can meet the needs and requirements of value-based contracting and payment models. If we go to the next slide, you can see some important information that has been shared through HHS's Unified Agenda. They have shared with the industry there is an upcoming Notice of Proposed Rulemaking, or NPRM. The notice has some specific information related to attachments, and this includes adopting standards for attachment transactions and electronic signatures used within the transaction. It does adopt operating rules that require acknowledgments be used for eligibility, claim status, EFT, and ERA transactions. It also adopts standards that require acknowledgments for claim status enrollment, disenrollment, and premium payment, COB, referral certification, as well as attachments. Lastly, it potentially modifies the standard for the referral or the prior authorization transaction from the 5010 version to 6020. Again, this is the information contained within the Unified Agenda. The NPRM is not out yet. CAQH CORE will notify all participants as well as the industry when it does come out, and will look for help in defining a response to the NPRM appropriate to meet industry needs. So you will hear more about that. Again, this will be critical when considering the development of standards and operating rules for attachments. The next slide, this shows that we are aligned with the rest of the industry. So we want to dive into some important initiatives and the strides that many organizations have made with attachments. I will begin with X12. X12 drafts specific standard requirements, along with implementation guides for healthcare and other industries. They do have, for example, a 275 transaction that is important for the use of attachments. There are many models that require the use of the 275. Many health plans today have implemented it, along with their clearinghouses and vendors to support this transaction. Another key stakeholder is HL7 and its Da Vinci project. As some of you may be familiar, this initiative seeks to develop a comprehensive framework and related standards for the exchange and integration of electronic information through the HL7 FHIR platform. WEDI, the Work Group for Electronic Data Interchange, is another collaborative group engaged in promoting electronic attachments. They provide solutions to critical healthcare problems, often through industry education via webinars and conferences, as well as the drafting of white papers that have become a cornerstone for much of the work that CORE does to ensure the industry can move forward with a progressive movement through the phased approach for developing operating rules. On this next slide, you'll see a few other initiatives we want to highlight. This includes the guidance on implementation of standard electronic attachments for healthcare transactions. This is a white paper jointly developed by WEDI, X12, and HL7, and is intended to be a resource to aid the industry as it moves toward an electronic and more efficient method for data exchange. There is a link provided to access the paper, and I would strongly encourage anyone who hasn't read the paper to do so, as it contains a blueprint for potential information of methods for modes of conduct for the transactions. The next initiative to be aware of is ONC's P2 FHIR Task Force. It's an ONC-convened group of health information technology health organizations that are collaborating again to accelerate the development of HL7 FHIR applications to allow for an API-driven approach for data exchange. IHE, also known as Integrating the Healthcare Enterprise, is also promoting the coordinated use of very specific standards like DICOM and HL7 to really address the clinical needs and support for patient care. They're really driving some of the data exchange and data content requirements for value-based payment models, as well as the administrative transactions. Thank you all. I hope you have a great day, and I'm going to hand the call over to Taha, who will discuss the CAQH CORE efforts on attachments.
Thank you, Mandy. So good afternoon, everyone. Again, my name is Taha Andrawala. I'm a senior manager here at CAQH CORE. And today what I'm going to do is provide an overview of CORE's work efforts on attachments to date and highlight some of the key insights from our recently published white paper on attachments. So on the next slide, I just wanted to point out that convening the industry together to solve challenges related to health administration has always been a critical goal for CORE. And we've demonstrated this through publication of 5 bases of operating rules, and we're really committed for attachment to maintain focus on this topic. And over the last several years, we've collaborated and engaged with more than 250 different organizations to date. And for example, we've hosted a 5-part webinar series on attachments, providing education to the industry on various technical standards and implementation experiences. And most recently, we engaged in an environmental scan to identify challenges and discover opportunity areas to support attachment operating rules and provide guidance to the industry. I'll be walking through the opportunity areas we identified later, that will be identified later on the presentation, but one to highlight that CORE will keep key principles in mind, which are listed on the table on the slide when drafting potential operating rules and guiding materials. Now, as an example, we plan to build implementable rules that fill in gaps and build up existing industry standards and efforts, some of those that Mandy had mentioned earlier, and versus creating brand new approaches. And so on the next slide, I want to highlight some of the industry burden and the current state of the industry on where attachments is. And as Mandy mentioned, there's no federal standard for attachment that has been adopted to date. And this really has created an environment where the attachment workflow is primarily a manual and the source of a significant administrative burden. So in examining the findings from the 2017 index, it was reported that an estimated 204 million claim attachment transactions were exchanged annually between providers and plans, and only 6% of those transactions were processed using standard electronic methods. So in the remaining 84% of those transactions were exchanged via manual methods such as mail and fax, and 10% were exchanged via portals. And these numbers are just for claims use case attachments. So as you can imagine, there are other use cases for attachments such as prior authorizations, value-based arrangements, appeals processes, and audits. So you can see that with all those use cases added up together, the amount of volume and industry burden for exchanging and processing medical information adds up. We really need more data to fully articulate the scope of the attachment challenge to date. And we really encourage health plans and providers to participate in our 2019 index study. And if you're interested in providing data, I believe collection efforts are still underway. So if you're interested, please shoot us a message and we'll reach out to you. So on this next slide, I kind of want to dive into our environmental scan and highlight some of our findings that we had in last year. We had more than 40 different organizations participate and contribute data points to us during our environmental scan. And these organizations included a diverse group of health plans, vendors, providers, clearinghouses, and were met across medical, dental, and workers' compensation markets. The environmental scan studied the current state of the industry to really find opportunities for CORE on how we can really determine to reduce burdens associated with attachments, the exchange of clinical and administrative data, and to promote industry adoption of electronic attachments by identifying areas for potential operating rules. And really to understand, primary reasons as to why, there's been a significant industry delay in the adoption of electronic attachments. We polled attendees on a recent webinar to really identify these causes. And not surprisingly, we had a majority of folks identify that they were waiting for regulatory direction from the government to mandate and adopt an attachment standard, which is probably not surprising at all. And however, I want to point out that almost a quarter of those respondents, about almost 25%, communicated they would be willing to wait for industry direction, meaning that these stakeholders would be willing to implement an electronic attachment into their systems if the industry were able to convene and coalesce and agree on standards to use today. And then interestingly, less than 10% of organizations listed budget constraints as reasons for delays, suggesting that there's really fiscal room within IT budgets for adopting electronic attachments. So on the next slide, as a result of our environmental scan findings, which consisted, as I mentioned earlier, interviews from lots of different stakeholders, and we conducted phone interviews, online survey interviews. We also visited several organizations on site. And after a culmination of all this, we published a white paper in May of this year to report our findings to the industry. And the white paper really examines challenges associated with the exchange of medical information used for healthcare administrative transactions, and pinpoints 5 areas that really can help support and accelerate industry adoption of electronic attachment transactions by creating a more uniform approach. The white paper is available on our website and accessible via the links on the slide. So on the next slide, in evaluating findings from our environmental scan, we were able to identify 5 opportunity areas that could benefit from uniform approaches. In order to ensure industry-wide adoption of electronic attachments and ensuring that the delivery is valuable and successful, we identified 5 areas, which included workflows, data variability, exchange mechanisms, infrastructure, and resources. And I'll be providing details on each of these areas, from highlighting, what the current state of the industry is, to current challenges, and, what are some of the best recommended approaches to resolve the challenges for each of these areas. So on the next slide, the attachment, with the first opportunity area workflows, attachment workflows really drive a significant burden for providers on health plans. And our environmental scan identified two significant industry challenges related to addressing attachment workflows. The first challenge being persistence of manual workflows, and the second challenge being around solicited and unsolicited attachment workflows. And health plans are really faced with a significant operational burden with managing attachments received via manual methods. And this includes from the collection, processing, scanning, reviewing, and storage of paper documents. And nearly 80% of attachments are received via this method. This is a lot of pieces of documentation that a health plan has to manage and process, which it could be burdensome given the amount of claims, prior authorizations that are needed for support. Another way is, looking at web portals, and other services do exist to manage claims and prior authorization submissions. And many of these portals do not have the capability to accept electronic attachments. And providers usually have to drop to using manual methods to send additional documentation. So providers are then faced with a disconnect and having frustration and having to use two different methods to facilitate information exchange, often resulting into reverting back to manual approaches. So as the industry, transitions to more of an electronic route, effective attachment workflows are really needed to be in place across all stakeholders involved in the information exchange to ensure success. And there are really two different common types of electronic attachment workflows. The visuals on the slide really highlight the solicited and unsolicited workflows for the claims use case. So looking at the solicited workflow, this is really a multi-step process, and is designed to ensure inbound documentation is a better match with the health plan's needs to adjudicate a claim or prior authorization. And in a solicited claim attachment workflow, a provider submits a claim, then the health plan sends a request for additional information back to the provider. That request for additional information defines, the type of documentation needed to adjudicate that claim. Then the provider then sends the requested documentation back to the health plan in an electronic data format, such as a PDF or a CEA. The challenge here identified by providers in our scan is that the workflow really does not occur in real time, often resulting in pending responses that then await review by health plan. And the time frame for which this process expires varies and causes uncertainty and delays in revenue cycle and sometimes patient care. And looking at the unsolicited workflow, and this is much more simpler, but a provider submits an attachment concurrently with an associated claim or prior authorization. And with the challenge of this workflow, as identified by health plans, that oftentimes providers submit too much, too little, or the wrong type of information, causing burdens and delays in their processing of the transaction. And as the industry goes beyond fee-for-service transactions, and as care delivery shifts to value-based payment models and care delivery, the industry definitely needs to be cognizant of attachment workflows in order to support care coordination in real time to support some of these newer emerging models. So on the next slide, I'd like to kind of highlight 4 opportunities and recommendations we made to really for the industry to consider when determining on how to promote meaningful electronic attachment workflows. So the first recommendation would be to enhance unsolicited workflows by embedding documentation lookup requirements across all use cases. This meaning that at the time of submitting a claim or a prior authorization, a provider should know exactly what documentation they need to send along with the transaction. This would alleviate any guesswork or unnecessary manual processes. The second recommendation would be to really encourage real-time information exchange for solicited processes. This would really bring value to providers and health plans to ensure information is being exchanged and also occurs in a timely manner, and really important for value-based care. The third and fourth recommendations address industry engagement and education around workflows to really ensure stakeholders have the knowledge tools and resources in place to make workflow improvements within their environments. On the next slide, I'd like to review the second opportunity area, which is data variability. And really, data variability is the degree to which data shared between parties diverges from an expected structure. So data may be non-uniform in the specific dimensions or file format or file size, for example, or data may diverge from the expected norm in submission patterns such as naming conventions or the use of the metadata within inside the transaction. And we identified in our environmental scan 2 industry challenges related to data variability. The first is the reassociation of an attachment to an administrative transaction such as a claim. And the second is the use of unstructured file types such as images or PDFs. So in relation to reassociation, when attachments are not submitted in parallel with the companion transaction, as in the case of the solicited claim attachment workflow that I walked through earlier, the attachment transaction must be linked or reassociated. And given the scale of inbound attachment operations at health plans, the volume of attachments that health plans receive, matching an attachment to the correct administrative transaction can present a big challenge. Also, while many transactions are now automated, remember most attachments arrive as paper documents, meaning the matching process often requires some level of human intervention. Sometimes attachments may be unreadable by a health plan due to poor quality, faxing due to errors in the OCR recognition, and oftentimes these issues cause breakdowns in an attachment workflow. And these unreadable attachments then result in the inability for reassociation of documents to occur, and then often lead into either pending request or delays in adjudication. So an electronic attachment workflow really inherently brings significant improvement because transactions can be then flagged with a reference number to really facilitate reassociation. The chart on the screen really highlights the various attachment data formats that are processed and received by health plans and vendors, highlighting the variability within file types. So as you can see on the slide, for health plans and vendors, PDF and images make up more than 50% of received data formats. And these are really unstructured data, so it'd be hard to really automate and create an environment where you're able to auto-adjudicate transactions. Mostly 2/3 of these attachments are, received in that unstructured format. So, health plans have emphasized, there is a wider need for adoption and support of more structured types, such as CDA, to really drive and promote more interoperability and to drive more electronic and automated attachment workflows. So on the next slide, really to address challenges in the variation in data for attachment transactions, we've identified 3 opportunities and recommendations for the industry to consider. The first recommendation would be to explore the value of potential operating rules on how to streamline how attachments should be linked to their companion transactions, such as a claim or PA, via defining metadata requirements for reassociation, and to ensure attachment metadata, such as patient identification data elements, for example, is accurate and consistent across information exchanges. Our second recommendation would be for the industry to consider defining predetermined data sets that could be used across all use cases and exchange methods. Our third recommendation would be to encourage the industry to coalesce on identifying requirements for file types, size, formats for the use of attachment data. This really would help address challenges around quality, readability, size efficiency for medical documentation exchange. On the next slide, I'd like to highlight our third opportunity area, which are exchange mechanisms. And exchange mechanisms really refer to how information is transported from provider to payer. Generally, these methods encompass manual methods that include mail and fax, upload via the health plan portal, or even proprietary solutions, and also fully electronic transactions. As a wait for a federally adopted electronic attachment standard, this has really led to a proliferation of options for attachment exchange. leading to the development of web portals and proprietary services. This has created a challenge for the industry by enabling a multitude of exchange options, with no one common standardized method to share information electronically. Only a small number of health plans have fully electronic submission methods available for providers. This really aligns with findings from the 2017 CAQH index that I highlighted earlier, where only 6% of attachments were tracked as being sent through electronic methods. And although these low pockets of electronic attachment adoption have been identified, most health plans participating in our environmental scan indicated that they are planning to or are already piloting capabilities to support at least one electronic exchange method to automate the request and submission of attachments between themselves and providers. And several of these electronic standards mentioned that are being piloted include XFALS 277 Request for Additional Information, or RFAI, which is an electronic transaction that can be used by a health plan sending to a provider to communicate and request the type of additional documentation that they may need. So, is it a progress note? Is it a laboratory? Is it an image? So you're really defining what that documentation should be. The next standard being piloted is the XFALS 275 transaction, which is a transaction used by providers and payers to exchange additional documentation, and such as a CDA or PDF in response to the 277 request for additional information. And the last standard being piloted is the HL7 FHIR standard, which is really a standard for describing data formats and elements in the application programming interface for how exchanging EHRs in a readily available, discoverable, and understandable environment. So on the next slide, I'd like to highlight two recommendations we identified for the industry to consider in regards to exchange methods. So as we look at electronic standards and methods for exchange of additional information, our first recommendation really would be for the industry to use standards and use structured data. So for example, requirements for using web services really could be beneficial to establish a base of how systems should connect and exchange information, followed by the need for how attachment information should be transported and formatted. Examples of these could be pairing the XFALS 275 transaction with a PDF or a CDA document in an unstructured or structured data format, or alternatively use the HL7 FHIR with an embedded CDA as your transport and documentation type. As other exchange methods really still do hold a strong presence in the industry, such as the use of web portals, we really think there's value in bringing greater uniformity and consistency to web portal transactions. As recently, CORE drafted a web portal rule for the PA transaction, demonstrating that there's definitely alignment needed between the business needs for web portal requirements. So we're really looking at that as a possible opportunity area to focus on as well. On the next slide, I'd like to kind of review our fourth opportunity area, which is infrastructure. And infrastructure really refers to the fundamental instructions that every data exchange system needs to work, such as how to connect with other machines, negotiate security protocols, and the basic expectations for each transaction. Our environmental scan identified three key challenges related to ensuring foundational infrastructure is in place prior to implementing electronic attachment transactions. The first challenge identified is the lack of clinical and administrative system integration, and the second being the lack of communication, and the third being variability in timeframes. So looking at that first challenge, attachments really uniquely combine data from two disparate systems, so clinical and administrative. For example, providers may have to use a practice management system to generate a claim or prior authorization, but then may have to pull clinical information from, let's say, an imaging system or their EHR. From our interviews, many providers reported the lack of this integration as key drivers in order to have a successful attachment exchange. So, we strongly believe that stakeholders must work together together to resolve these interoperability challenges by establishing common rules for how systems should connect, share, and secure data. So once these systems are able to connect and share data, communication then becomes vital. When information is exchanged, the communication should be acknowledged. Oftentimes, providers are left in the dark, not knowing if the information sent was successfully received. And findings from our environmental scan show that health plans acknowledge about 25% of attachments received. The inability to communicate acknowledgements may lead to resubmissions of documentation, phone calls, or unnecessary follow-ups that lead to increased and unwanted burden. Looking at timeframes to adjudicate an attachment, stakeholders do not have common expectations for turnaround times. Most providers interviewed during our environmental scan indicated that delays in adjudication of claims-related transactions with attachments have not delayed patient care. But in the case of prior authorization, one behavioral health provider indicated that patient care was delayed in about 40% of cases as a result of additional documentation requests. If we move into the next slide, we can see that although response times vary greatly across exchange modes, there is strong alignment around the value of fully electronic transaction as adjudication timeframes greatly improve. During our environmental scan, we asked providers to estimate adjudication timeframes for attachment-related transactions. And on average, providers reported that it takes health plans 44 days to adjudicate a claim with attachment sent by mail, 16.5 days by fax, 5 days by portal, and 2 days by EDI. So just looking at this, the timeframes for approval are improved 22 times faster, again, 22 times faster when using electronic methods over mail. Looking at recommendations for the infrastructure opportunity area, one of the key things that we recommend, so in addressing these infrastructure challenges, the same common infrastructure requirements apply that CORE has developed for all our prior phases of operating rules, such as the need for common connectivity and security frameworks. Further operating rules that we have in the past around acknowledgements, response times, system availability are really important to ensure systems are securely open to the exchange of electronic attachments and that communication needs are being met. We've summarized some of these key infrastructure needs as part of the 2 recommendations on this slide. So the last opportunity area that I want to talk about today is resources. The resources are really the single sources of truth utilities maintained for the use of industry by a trusted, capable party facilitating the collaboration and driving consensus. So kind of what this means is that, stakeholders participating in our environmental scan identified 2 recurring challenges related to the need for resources. The first being non-uniform documentation requirements, and the second being the lack of transparency. And this is all really related to payer policies on when and what requires additional documentation. The variability and the lack of transparency in attachment policies and the frequency where policy changes occurs really pose a significant administrative challenges for providers and vendors. Providers reported that documentation requirements change and are non-uniform from plan to plan or even within the same plan, as various insurance products from the same plan even have different documentation requirements. For example, to obtain approval for a certain procedure or get a claim paid, one health plan may request to see images or radiographs, while another health plan may request progress notes for the same sort of procedure. Even with these varying documentation requirements between plans, providers have reported that this information is not readily available and accessible. From a vendor perspective, vendors have stated that this non-uniformity and lack of transparency makes it more difficult to develop, support, and maintain solutions to help support an electronic attachment exchange. On the next slide, in the case of attachments, the need for common resources and tools to be shared among users is definitely important. And we've identified 2 types of recommendations on how we think the industry could build greater transparency and uniformity within documentation requirements for attachments. The first recommendation calls for the creation of a standard companion guide so that requirements are outlined and structured with a uniform flow and format across call plans. This really would reduce burden and ease application and system development for electronic attachment solutions. And we have companion guide rules for all previous transactions that CORE has published. And the second recommendation calls for building transparency and identifying common services that often require additional documentation. So having this information defined and available really helps improve the overall attachment workflow. So with that, I've highlighted and I've talked a lot, and I'm sure the audience has a lot of questions, but I've highlighted key findings from our attachment environmental scan, and I'll hand the call over to Jessica to kind of walk us through the next section of our call.
Thank you, Taha. Thank you for summarizing the key findings in the environmental scan. And tomorrow when we send all of you the material from this webinar, you'll be able to click on the hyperlinks within the presentation so you can access the various reports. So let's take a moment to pause and answer a quick poll. As you know, we've been doing a series on attachments, and we want to hear from you what you'd like to see next in terms of an educational webinar. So please feel free to select any of those that might be of interest to you, and that will help us with our programming. So I'm going to give this a couple of seconds, and I'm just going to share the responses, and Taha, if you have any insight on this, it would be welcome. But this is honestly just helpful for educational purposes. So let's go ahead and share the responses, because it's interesting to see maybe what the pain points and challenging areas still are. So what do you think, Taha? It seems like the overview of the current and emerging standards is a winner, but there are a few others that are.
Yep. So, and I think that's kind of really, really informative to kind of how we can guide our future work efforts on our attachments. So the overview of current and emerging standards, providing that base guideline of what the different standards are, what are the different use cases, what are those methods of changes in the data to support the transport, I think is really valuable. And I can see that there's really great interest in then diving deeper into each one of those standards. So I think that 12 topics and HL7 are like the two key ones that we keep hearing to date. So I think, some good information for us as we build out our future webinars and what education we could provide to the industry.
Thanks, Taha. So let's move on to our next presentation, which is, kind of what our next steps are in this initiative. And so we're going to have CORE Associate Mariana Singh present this next section.
Thanks, Jessica. As she mentioned, my name is Mariana Singh, and I'm an associate here at CORE, supporting the Attachments and Prior Authorization Initiative. As Taha mentioned, there are a number of things we can work on as an industry group to address some of the biggest challenges related to the exchange of additional documentation or attachments. On this next slide, you'll see that we've done a lot of work to start this initial project. We do understand that as an industry organization, we really need the rest of you to help us move forward with some of the progress that we've made today, and to making potentially a set of operating rules related to the exchange of additional documentation and attachments. We know that attachments really are opening the line of communication directly between administrative and clinical systems. A lot of that integration is still needing to be built and developed and understood in a way that is meaningful for all of our constituencies as well as for the participants on the call. So we really need people from all sides of the spectrum, from health plans, providers, vendors, and clearinghouses, to weigh in, who can identify limitations with those systems, data needs and requirements, where the best source for these data points may be. Working together, we can make sure that we have very successful outcomes as we look towards improving the healthcare system. Many leaders have worked together to do this in the past with other initiatives, and again, we're calling on you to work on this particular initiative to ensure that we can change the model that is a very manual and paper-based, tax-based process today. Our environmental scan findings published in the white paper in May indicated, as Taha mentioned earlier, that most attachments are sent via mail and fax. Very few are sent electronically or even partially electronically. Again, as we look at how we will develop operating rules with input and feedback from industry, building off of the information that we've had from our environmental scan It's going to be really important for us as we continue our work in 2019. On the next slide will be our call to action, which is looking at what we've done in our environmental scan and building off that with the additional training and guidance materials that we'll be sharing with the industry throughout the year. We're looking to build implementable solutions for the industry through a phased approach, as CAQH CORE has done in the past. Next steps that we need to consider is not only the NPRM that Mandy mentioned earlier, that may be coming out addressing attachment standards and operating rules, as well as other standards like acknowledgments, will be very important for the industry. CAQH CORE will continue to track what's going on in the regulatory world, as well as progress forward in 2019 with our work on attachments. We'll be launching an attachments advisory group in the coming months. The advisory group will be a subset of industry leaders that are working currently on the topic, have subject matter expertise, or have a lot to say. Let us know if you're interested in working in our advisory group, and we can add you to the roster. CAQH CORE is also working on a prior authorization pilot project, which includes piloting the exchange of additional documentation sent either currently with the request or after append. So if you're engaged with the industry and any of these particular topics are of interest to you, and you want to work with us on developing the next set of operating rules or piloting potential rules to tackle this topic, please feel free to reach out. With that, I'll hand the call over to Jessica. We do have another polling question that we want to get from this particular group.
Thank you, Mariana, and thank you for setting up the next polling question, which I think we can go ahead and launch. So Mariana just mentioned some of the key next steps, and our work is only as strong as how many people we are able to collaborate with our participants and also with the industry at large. So if you're interested in joining either the attachments advisory group or interested in learning and getting involved in the prior authorization pilot, please answer this poll and we will reach out to you. So for those of you that answer yes, and I'm sure we will reach out to you with more information. And I don't think we need to share this poll since it's internal, but thank you so much for those of you who have answered yes and who want more information. So now we have time for Q&A. I'd like to remind you to please submit your questions by typing them into the questions panel on your dashboard. We also received some questions during registration, so I think we can get started with some polling questions. With some questions. Forgive me, I'm focused on polls. So the first question for Taha, what role does FHIR play in exchanging medical documentation?
Sure, that's definitely a good question. And FHIR is definitely an emerging standard, and definitely a hot topic in the industry. So really, FHIR is definitely a data model and exchange mechanism on how information can be exchanged. But what the value for FHIR is that it can actually pick discrete data elements. So for example, you may need one observation in the EHR. FHIR is able to exchange and facilitate that information exchange from that one data point from a provider to a payer. So that's kind of the value of that versus looking at other methods of documentation transportation where you may need to send the whole document or a whole progress note. So that's kind of where the value of FHIR is and what role it can play with information exchange is really going down to that discrete data element and facilitating that information exchange in an open environment that's easily connectable, exchangeable, and readable.
Thank you, Taha. So we did get a question that I think I can answer, and it's whether we're following the proposed regulations that CMS and ONC released on interoperability. And so I'll say two things. One is that we did respond to both NPRMs, and our comment letters are on our website. And in both letters, we did, as part of multiple comments, we did strongly recommend that the federal government issue its attachment standards. So we're definitely monitoring and interested in that topic. The next question for Taha is, what is the structure of the data being carried in the 275 attachment standard?
Sure. So the 275 attachment standard, think of that as a way to transport information back and forth between a provider and a payer, so really facilitating that exchange of information. And within the standard itself, you can actually embody data. So you can embody actually structured data and unstructured. So you have the options to transport unstructured data, being images, PDFs, Word documents, things like that, or you could also embody a structured format. So you could actually embody CDAs that are more structured, so that way that can help more of the automated adjudication process. So really the 275 is that transport mechanism that can manage and embody different data elements. And I think one of the pain points from our environmental scan is really trying to nail down, a pair that's really successful and viable for the industry, so that way you're not having to support multiple different data file formats and standards. So more to come on that, but it can really carry structured and unstructured data.
Great. Another question for you, Taha, is whether this has to do with attachments for the 1500 form.
Sure. So I believe the 1500 form is the CMS claim form. So ultimately, the end goal for us is to really promote electronic attachment workflows for all claim types. So whether it be so for any sort of claim you may send electronically, to have electronic attachments that support that workflow. So yes.
Great. And so we got several questions about the status of the attachment NPRM and whether we could predict whether it would be this year or not. Yeah. Do you have any reading the tea leaves?
Yes. So I guess for that question, I guess my insight is that's still in what we've heard and what's been recently published. So I know the Unified Agenda, the spring 2019 one, was recently released in a month ago, I believe, and really came out with the same recommendations. I don't think no new updates, and I believe the date anticipated for the release of potential NPRM was listed as December 2019. But again, we really don't have any official word from HHS or CMS on when something could come out. But we're really looking at the Unified Agenda and really monitoring the federal activity, and we'll definitely provide the industry with update as soon as we hear something.
Thank you, Taha. I think we all sort of check that fairly regularly, and we're excited whenever it does come out. So just a note, there were a few questions that came in that were a little bit specific and would probably not be appropriate to answer here because we need to do a little bit of follow-up. So for those of you that we didn't get to your question, please send them to our inbox and we'll be happy to work with you and respond to those questions. With that, let's go on to the next slide. So here are some of our upcoming webinars and conferences that we're going to be attending. In the next day or so, we're going to be sending you the slides. And so once you get them, you'll be able to click on the hyperlinks in this deck, and then that way you can register for the webinar, get our environmental scan, access the other hyperlinks. But if not, if you are just super excited to register for any of these webinars, go to our website and you can register that way. And then with that, we can go to our last slide of the day, which is just the various ways that you can access our information. And that email address there is the one you can access if we didn't get to your question today, or if you have any other questions about our work and initiatives. I'd like to thank you for taking the time to join us today and hope you have a great afternoon.